Thanks, everyone. Happy Thanksgiving. And thanks for joining us today for the Toll on Our Kids, a conversation about West Virginia's kids in the drug crisis. I'm Kelly Caseman, Executive Director of Think Kids, and with me today are Cindy Chamberlain and Robert Peters. And the topic for today's Facebook Live is the toll on our kids. We have a lot of ground to cover in the next hour. Before I introduce our guests, I want to let you know that at any time, you're welcome to write any comment or questions you have for our guests in the comments section below the video, and we'll take a few breaks from the dialogue to respond. Many thanks to our intern, Maddie, for managing our Facebook page for us today. So our first guest is Cindy Chamberlain, a physical therapist with over 25 years of experience working with children. She's worked with the Birth to 3 program for more than 16 years and with Clay County Schools for more than 10 years. Prior to that, she implemented the developmental care program at Raleigh General Hospital's NICU. She continues to work with neonatal abstinence syndrome babies and has seen a steady increase in their numbers. She is the West Virginia chapter president of To the Moon and Back, a nonprofit dedicated to providing support to the families and professionals working with these children. Welcome, Cindy.
Thank you.
Glad you're with us today. Second guest.
Happy to be here.
Great. Our second guest is Robert Peters, Senior Attorney of the Zero Abuse Project, where he develops and delivers state-of-the-art training and comprehensive technical assistance to prosecutors and child abuse multidisciplinary team members on crimes against children. He served as an assistant prosecuting attorney and special prosecutor in multiple West Virginia jurisdictions, where he specialized in the prosecution of sexual offenses, civil child abuse and neglect cases, and juvenile crimes. In addition to his prosecutorial experience, he authored several child protection related articles in peer-reviewed publications, including the Florida Journal of International Law, Handbook on Interpersonal Violence Across the Lifespan, and Christian Ethics Today. While in law school, he clerked at the United States Attorney's Office in the Western District of Virginia. Prior to serving as prosecutor, he designed comprehensive child protection policies for numerous entities, including educational institutions, churches, and parachurch organizations. He's also the founder and chairman of the SHIELD Task Force, a 501c3 nonprofit that partners with child advocacy centers and local stakeholders to encourage reporting of sexual abuse and online safety. Welcome, Robert.
Thanks, Kelly, for having us. Looking forward to our discussion.
Oh, great. Well, then we'll jump right in. And it's a question for you both. We will start with you, Robert. Tell us about your work and how did your work lead you to working with children affected by the drug crisis?
Yeah, so as a former prosecutor, certainly that's something we saw. Early on, the first prosecutor's office I worked with, I handled the juvenile docket as well as the civil child abuse and neglect docket. And that was right around the time that we saw just this massive increase a few years back, which was certainly driven to a large extent by the substance abuse crisis. So that was my first rude introduction to the issue right out of law school. And just a variety of ways it certainly impacts children and caregivers and certainly has quite a few ripple effects. I also encountered it a good bit, obviously, on the juvenile docket, just with, every one of those kids has some sort of background in some form of abuse, typically, be it physical abuse, sexual abuse, and certainly we see ways in which those who seek to exploit children target those types of vulnerabilities. And if there's substance abuse in the family, that's certainly one of those vulnerabilities that offenders seek to exploit. So that was I was introduced to it there on the juvenile side as well, and certainly saw it as a foster adoptive parent, and now in my present role, providing training and technical assistance to prosecutors. They're seeing this everywhere, not just in West Virginia, but across the nation.
Great. Robert, Cindy?
Well, I've been a physical therapist for 25 years, and my first exposure to children born substance exposed or with neonatal abstinence syndrome was in the NICU. And that was back from 1999 to 2001, where we were just starting to see we might have 1 or 2 children in the NICU at a time. And we all very quickly realized that these kiddos were not easy to handle. And so when I would transition into the nursery, they were always ready to have me wear that baby or try and comfort that baby. And like Robert, over the last 10 years, I've seen a steady increase and incline in the families impacted by substance use, and then also these babies born substance exposed. At different times over the last 10 years, I've had 50% of my caseload in birth to 3 be those children substance exposed. And what I have learned is that these are not bad children, they're just different. And so we really need to work on stop trying to cram a square peg into a round hole, but rather celebrate that square peg and figure out how we're going to help them succeed in the world.
Thanks, Cindy. So one of the reasons we decided to have this conversation on Facebook today is because while many of us know that parental drug abuse, or use, I should say, has created a crisis for child health and well-being in our state, many who do not work directly with children or with the affected systems do not understand how this crisis is affecting them. The statistics tell a dark story. According to the West Virginia Department of Health and Human Resources, there are over 7,000 kids in foster care in our state. I remember when I started working on this issue in 2015, we were shocked that the number had moved up to 5,000. And here we are at 7,000 5 years later. Some of them have run away from foster care system. 482 kids did, and some of them ran away more than once. Since 2013, there has been a 67% increase in the number of children in state custody in our state, and that compares to 11% increase nationally. And so we know we're looking at a really complex issue, just how the drug crisis is affecting our kids. So let's try and approach the subject today chronologically. Cindy, for a child born exposed to drugs in utero, what are some of the physical and behavioral effects?
Well, I think that we as a society need to kind of stop considering these kiddos as born neurotypical because they've had substances pass through the placenta through oftentimes much of their pregnancy. So their nervous system is developing a little bit differently. While we are allowing and having researchers gather all of that data and kind of identify what substances do what, for anybody who has been a parent, I will just say that these kiddos are a colicky, difficult kiddo times 1,000. They often have difficult times just regulating themselves, their body temperature, and their kind of homeostasis or ability to calm. Just at rest. And so lights in a room might send them over the edge. Often they have tummy issues because their nervous system or their digestive system isn't quite right and seems to be more sensitive to reflux and changes in food and diet. These kiddos also tend to have problems with chronic ear infections. They have visual issues, sensory processing issues, and then developmental issues. So right from the get-go, as far as I'm concerned, every single one of these children need to be referred to birth to 3 so that we can start educating and empowering the families on what they need to do, which is focused on typical development, which is a challenge because they don't like tummy time. They're difficult to soothe. And so the other part about that is we really need to recognize, especially if these children are going back into a home with a birth parent and there's active substance use, we're not looking at one diagnosis, we're looking at 2 diagnoses. So we have complex issues in the home and we need to be providing more wraparound supports to help this family succeed, and we're helping the child develop appropriately.
Okay, thanks, Cindy. Also for you, for children being raised by someone with substance use disorder in the home, can the environment itself have an effect on the development of the child?
Absolutely. As I just said, that, you know, it's like we know that these children need some extra love, need some extra care. And if there's active drug use in the home, we know that this person or the parent's priority is not necessarily on their baby. They're still focusing on their drug use or themselves or their mental health, what have you. The research shows that the #1 important indicator of later success in life for children is bonding with the caregiver before the age of 2. if you're not able to bond with a caregiver, what we know is these children tend to develop a little differently, tend to struggle. And the other thing that we know is that children born with NAS have smaller head circumferences. So as a physical therapist, smaller heads means less brain cells, and I want all the brain cells that we can offer a child. So that bonding aspect is really, really important. And what we tend to find is that while these parents are doing the absolute best that they can, there's a certain level of kind of passive neglect that happens because they don't want to shake the baby, they don't want to hurt the baby. So they put the baby down and walk away. But then also, while they may be experiencing a high or maybe passed out, that baby is also going without care and neglect. And so that bonding and stimulation part of it really is almost like a failure to thrive baby, because they're not getting the needs that they're not getting their needs met, and they're not learning that there is someone safe there to come to them when they cry.
Thanks, Cindy. So this is a question for you both, but we'll start with Robert and give Cindy a bit of a break. For kids starting school, what kind of different behaviors should could school staff experience, and how can they respond in a way that would be helpful for children who have been directly affected by drug use in the home?
Yeah, great question, Kelly. And everyone responds differently to stress or to trauma. So it certainly can vary child to child, but it can be a huge spectrum. One concept I want to float out there that might impact what those responses might look like, or what those behaviors might look like, rather, is the concept of polyvictimization. And if you're not familiar with polyvictimization, it's what we know from literature that a child who is abused in one way has typically been abused in more than one way. So for example, 66% of children who have an ACE score of 1, an adverse childhood experience of 1, be that sexual abuse, emotional abuse, physical abuse, neglect, whatever the case may be, 66% of them also have an ACE score of 2 or higher. So they're typically struggling with a variety of different things, and that can impact their behaviors. And so I teach courses to investigators and prosecutors on looking for corroborative evidence. And so this concept comes into play there, because oftentimes a child's behaviors are corroborative of the types of abuse or experiences that they've endured. So that can come into play in a variety of ways. It could be sexualized behaviors if it's sexual abuse. It could be maladaptive behaviors for a variety of forms of abuse, cutting, substance abuse themselves if we're dealing with a little older youth potentially, or it could be accommodating behaviors. And I think you can see those at virtually any age. A child who really needs to be very present, might be referred to pejoratively as clingy, things like that, really seeking connection to what others might view as an excessive extent, accommodating type behaviors. So it can run across that spectrum. On the maladaptive side, you could see violence, even with really young kids. As a foster parent, we had at least one child who really exhibited violent behaviors as a toddler. And so that wasn't a child who we really knew much of an abuse history, because obviously, that child couldn't talk. But clearly that even at a young age, they're internalizing this trauma, be it of abuse or of neglect or of exposure to substances, whatever the case may be. And they're exhibiting behaviors in an individualized way in response to that. So to the second part of that question, how can we respond to that in a way that would be helpful? I think one of the most important things that we can do is listening, particularly when we're dealing with verbal children or even nonverbal children to some extent, is just listening. And so Libera, I don't know if either of you are familiar with the work of Libera and Karen Herring, great nonprofit here in West Virginia, but they do some important work in the space, as does Cindy and her organization, around kids being heard, just listening to kids, having them be heard, seen, validated. And so that takes time and trust. It's not something, if we take just a check the box approach as educators or as others, it ain't going to work. Kids are smart. Kids are smart. They can see when you're doing things by the numbers versus when you're really there to invest in them, certainly. There's a really good point that Karen actually had made to me recently, and it's just the concept that once you hear someone's full story, you can't judge them. And so it's sometimes it's hard for adults who are working with traumatized children to have patience, and when they're working with traumatized adults, frankly, to have patience. But there's always a why behind that behavior. I thought there was a really good Handle with Care post recently that said the kids who need the most love will ask for it in the most unloving of ways. So that's my rambling response to that. I would point viewers certainly to the Handle with Care virtual conference toolbox. Go to handlewithcarewv.org. Excellent resources there if you want to take more of a deep dive into just different tips and techniques in this context. Also, you can check out shieldwv.com. We have resources for parents and teachers and churches as well on trauma-informed approaches.
Thank you, Robert. That was a great answer. Cindy, do you have anything to add?
Well, I think that like just when we look at the school system, what many teachers have said or have experienced recently is that they're finding their classrooms are, you think when you enter kindergarten, we know our name, we know our colors, we, can count to 10. And what teachers are finding as we transition from what I like to call a child-driven world, where they're kind of able to do whatever they want, to a more structured environment in school, is that the expectations or the emotional energy that it takes to behave isn't there. And so these kids are going into that fight or flight mode or overreacting, which is like kind of what Robert said, might be throwing things, might be hitting things. And it's, again, not because they don't want to sit on that red circle that Mrs. Jones wants them to, but it's that control or that loss of control and the fear of losing that control. And so they're overreacting to try and get some of that control back. What I have seen working in the schools is lots of alternative seating, lots of getting up and moving. I know mindfulness programming in the schools and yoga in the schools has made huge differences. But just as Robert said, going into that no judgment zone and taking the time to listen. These are kids that are you're not gonna get a quick fix. They take the extra time, but when you invest that extra time, it comes back to you tenfold, because then you start forming those bonding relationships that they need. And the other thing I will say on that too is we tend to assume that home is the safest place. And for so many of these children, once they start coming to school, school becomes a safe place for them. And so I think that we need to honor that. And we need to embrace that, because it's so important that these kids have routine, so important that they have stability, they know where their food's coming from. And of course, right now with COVID, that's a challenge for all of us. But these kiddos are really, we need to take a step back and embrace them just a little bit more. And as Robert said, I know some of the earlier talks with the Handle with Care Toolbox and conference this year really talked about kind of lowering our expectations as we started virtual classrooms this year, and just working on behaving and just being present and knowing the rules before we jumped into the cognitive aspect, because we're all still kind of stuck in our rear brain right now, or our brain stem, and we're not able to access our cerebral cortex. I know as an adult, I'm struggling with that. So I can only imagine what some of our kids are going through.
Right.
Great points. Thank you both for that. Before we move on to our next questions, I want to turn to Maddie, who is manning our Facebook page, to see if we have any questions or comments. Maddie?
No, excuse me, no questions. Just one comment from Nelson Jones. He was saying poor kiddos, and I mean, it is unfortunate to hear about that, but no questions so far.
Okay, great. Thank you, Maddie. Okay, we will move on to our next round of questions. I believe our next one is for Robert. Your organization has created a series of videos to provide school children from elementary grades to high school information about wellness and safety, especially now with the pandemic. Why is this messaging important, and is there important safety information for all of us to consider when thinking of the safety of children living with parents or caregivers who have substance use disorder?
Yeah, there certainly is, Kelly. And I think so maybe a bit of background on the videos. These are ones that we'd quickly put together during early days of the pandemic, focusing on body safety, digital citizenship, and personal wellness as well. But one of the things that concerns me just on the national scene, and it's certainly happening to some extent here as well, is the increase in online sexual exploitation and just several dynamics that are risk factors for children generally, but particularly children in these types of homes that we're discussing where there has been exposure to substance abuse. So we know from the literature surrounding grooming, for example, and I should probably define that if anyone watching isn't familiar with it, but this process of creating trust and creating authority in order to manipulate a child, in order to prepare a child for abuse. The first stage of grooming is targeting. And so that can look differently depending on the offender and the offender's age and the access that an offender has to children or the lack of access that maybe an offender has to certain categories of children. But nonetheless, we know that offenders target children who are less likely to disclose abuse or who are less likely to be believed when they do disclose abuse. And so just anecdotally looking back at my caseload and the cases I assist prosecutors with now, the substance abuse in the home is a factor. It's definitely a factor. You'll often see victims of sexual abuse, in particular in homes where maybe there's an absent caregiver or multiple absent caregivers, where there is extensive substance abuse in the home, or there's an extensive history of CPS involvement. And so, again, there's less likelihood that that family is going to be believed. There's less likelihood that that family is supervising the child, so there's probably more opportunity for the child to be alone, to be vulnerable, to be isolated. And then when that child comes forward, what do we say? And frankly, we hear it from investigators sometimes, or from juries, God forbid. Oh, this is a bad kid, right? This kid comes from a troubled past. Why should we believe this? Well, that's the whole point. That's the whole point of the grooming
Caleb,
process.
stop.
Yeah, that's the whole point of the grooming process, is to reduce that type of credibility. So we need to certainly be cognizant of that. My least favorite phrase in the English language, well, one of my least favorite phrases is "he said, she said." Right? More often than not, that's an excuse for not doing your job, quite frankly, or it's a demonstration of inadequate training. Because quite often there are these corroborative pieces. We just have to do the work. But why that phrase annoys me is because that's what offenders want. That's the whole point of the grooming process, is so we conclude that it's a he said, she said. So that vulnerability is certainly something that concerns me when it comes to a youth from these homes. I think also there's just less supervision generally with all of us, right? We're working from home. We're busy. We're happy to hand the kid an iPad and be like, all right, please. And I get it. I'm a parent. I get it. But the less supervision certainly increases the risk of online exploitation. And we've seen a huge explosion of online exploitation nationally and globally. Aggregate of the 47 national cyber tip lines for reports of online child exploitation, all of them are up. NICMEC, the first month of lockdowns, those reports doubled. The second month of the pandemic, they quadrupled. On the year, they're way up. And it's not just this statistical piece. We know from monitoring, for example, dark web forums, that this is all on offenders' radar. They're cognizant of the fact that children are more vulnerable. And so to break that down a little bit, if you're not familiar with the dark web, there are corners of the dark web that are really problematic. Not all of it's nefarious, but there are corners of the dark web that are websites hosting child exploitation material, child sexual abuse material. And on these websites, it's not just about distributing child sexual abuse material or uploading it. It's also about forums to strategize and to trade tips and tricks for grooming children and abusing children. And so they're talking about how the pandemic increases the vulnerability of children. They're talking about the type of children that they target. They're talking about the isolation of children and how it enables them to do more and more of these horrific acts. So it's certainly on their radar, needs to be on our radar as well. Another thing I would say in terms of information for us to consider as parents or caregivers, maybe particularly. Obviously, that supervision piece is pretty important. More so having a conversation with children, or if we intersect with any of these kids as educators or in any other capacity, just having a good relationship where they know if something does happen in an online space, they can come to us. We'll be non-judgmental, as Cindy said, and have just that conversation, and there's that trust built up. The other thing I would say is this week, actually the last 2 weeks, I've gotten more calls from foster parents, I think, than ever, just about different challenges that they're facing, systemic challenges for a variety of reasons. But there are a lot of challenges to these kids from a systemic standpoint. It's the perspective of foster care parents that I've talked to, that there's a bias against them, against the kids, and against the parents, quite frankly, in a variety of ways. Frankly, sometimes in the medical field. That's not something I had experienced as a foster parent. We had wonderful medical care providers, but some are saying that they're just not looked at the same way, that there's sort of a second tier. And then one thing I did see, or that I know to be the case, is that right now there are juveniles who run away from home and no one's actively looking for them. And if you look into this, they'll say, oh, well, we put, a report into, whatever they put a report into. And so if someone comes across them, okay, they'll flag it. But who's actively looking for a lot of these kids? We know those kids are at the greatest risk of exploitation. So I would end my very long-winded answer with a quote from Bosch. I don't know if either of you have seen the great show Bosch on Amazon Prime, but he has a great quote: everyone matters or no one matters. And I would suggest that's certainly true of these kids as well.
Wow. So what I'm hearing is these kids have more of a need for people to listen to them, and yet they're actually listened to less, and there are real consequences if we don't listen to them, because they're targeted by online predators, because it's understood that they are listened to less. And then when you have foster care parents who try and be that advocate for them, then they're listened to less as well. So
that's really well put. I'm going to come back and view this and write down your more succinct version of that. That's very well put.
Well, you were saying that, and I was thinking, wow, this is just really sad, because it seems to be a whole problem, that just grows, and
Right.
there's some real negative consequences that we're all experiencing because we're not listening to the needs of these kids.
Exactly.
Well, and I think, like, to build off of what Robert said, and then kind of what we had briefly talked about a week ago, is that, it's also like these children take more time, these families take more time. And that's one thing that we don't have right now. CPS numbers are down, not because cases are down, but because we're not getting eyes on families. CPS is doing much more, a lot more calling, maybe not as much in person. Teachers aren't seeing their students as often, so we don't have those eyes on them. But then the other trickle down of that is that families who already have an open CPS case are having children sent home with them, like maybe from the delivery room, who have experienced NAS, but the system is sending them home into a home with active drug use because there's already an open CPS case. But we don't have enough levels of support to support and keep those children safe necessarily. And so those are the things that all take time. And of course, none of us expected COVID. None of us knew what to do through COVID. And our challenge is that we're losing children. They're not just slipping through the cracks, they're falling through the cracks. And our system isn't able to keep up with that right now.
I completely agree. Moving on to the next question, because I think it builds on what we were just discussing. It's not unusual children who have grown up experiencing neglect or traumatic experiences to share oppositional behavior or persistent defiance. I have two different questions for each of you. Cindy, can you tell us more about the physiology of trauma?
Well, I will encourage anybody who wants to learn more about trauma to go to the Handle with Care website, and then also look at ACEs and adverse childhood experiences, so that you can start understanding just how deep trauma can be and how long lasting it can be. Basically, I'm going to summarize it in like 30 seconds, but trauma impacts your brain's nervous system to your sympathetic and your parasympathetic systems. Your sympathetic system is that fight or flight. If the house is on fire, I'm going to go get out of it. The parasympathetic part of your system would be, is it a big enough fire I need to leave, or do I need to get the fire extinguisher to put it out? But the problem when you experience trauma is sometimes your hormones are always at that fight or flight mode. So what happens is somebody says, please go pick up the blue block for a child, and they want the red block, and they pick up the red block, and then they're punished, and then it explodes into a meltdown, and they become defiant, they throw things, and it's not anything to do with the block, it's that they never felt safe. And so again, having teachers and professionals understand that is paramount. And then with our neonatal abstinence children or our substance exposed kiddos, you add the unique sensory challenges that these kiddos have, not regulating or not understanding proprioceptive input or that ability of touch, or their vestibular system, which is the sense of movement. And so you put that fight or flight, the increased levels of adrenaline into their system, and those proprioceptive and vestibular challenges, and these kiddos look like a hot mess. And they're not, they're just different. And so we need to be taking the time to understand why they are different. And, when Robert talks, and we've talked about talking to children, the younger kiddos, the kiddos in birth to 3, the children that I work with, they communicate through play. And so, most adults don't know how to play with kids. We think that the toy is what's meant to play with them, but it's not the toy. The toy is the link between the child and the parent or the caregiver to facilitate that bonding and to facilitate that play. And so kiddos who are constantly throwing things, you know what I mean? We need to figure out what's going on so that we can take it down to their level and play with them so that they can start to communicate and they feel safe communicating with you as they get older. I'm not quite as eloquent as Robert is.
True. That was well put. Well put.
Great. And you and I have talked before about the importance of this time and resources to come early.
Yes.
When they, preferably before they even get to school, but in those early years. And for those who this may be all very new for you. And you use some technical terms, Cindy, and people may think, well, why isn't anyone doing any work around this in our state? There is a lot of work that's happening. We'll put a lot of those links on our YouTube channel and our Facebook page. So if you are interested in learning more about what's happening around our state, Handle with Care has certainly done a lot of work. The ACES Coalition's done some work. Robert's videos, we'll put a link to that as well, so you can acclimate yourself to kind of what it's looking like right now. But we certainly have. Oh, thanks. You want to talk about what that is?
Yeah, I was just going to say, and this is Reclaim West Virginia. And so the Department of Education, West Virginia Department of Education, and they've put a whole book together, and it's a toolkit for teachers and families who are looking for information on families who are experiencing substance use disorder. Because what was it, about 18 months ago, Frankie Tack did that study where she polled teachers on, do you know what to do with children who have active substance use disorder in the homes? And resoundingly, 90% of the teachers who responded to that online survey said, no, we don't. And so it was I was like, yes, we're finally talking about my kiddos. But it was a real wake-up call for a lot of people that says, hey, we need to get more supports in place because our children need help, but our professionals also need that help.
Yeah.
Right. Thanks, Cindy. And again, we'll share all that information. And I have a question for Robert. And of all the questions that I prepared for him, this is like the big question. This is a question that can be its own Facebook Live, but I think it's real important to bring up. These children often have lives very apart from school and very different than the ones that you and I may have and teachers have experienced. And that's their involvement with the child welfare and court systems. For those of us who have not been through or worked with these systems, what's it like, and how can these experiences affect the child?
It's really difficult. It's really difficult, Kelly, and I've seen this on the prosecutor end. I've seen this on the foster parent end of things as well, and on the criminal side with as a prosecutor, but also on the civil side as a prosecutor. And it's really, really difficult. I that's the short answer. It's really, really difficult. Maybe something that would be emblematic of it. I did a little bit of research when I was working on a public policy issue, I think last year, or the year before, and I was sort of compiling, okay, what at what points is the West Virginia Code talking about the rights of defendants and those who are alleged to be abusive or neglectful caregivers versus what are the rights of, say, children or victims more broadly in the criminal adult realm. And there is a tremendous disparity. And I don't have the exact numbers, but it's a lot. It's triple digits versus maybe not double digits on the victim side of things. I mean, it's a huge, huge disparity. So something to keep in mind, the court system ultimately is designed by, for, and for the benefit of adults. And there is some language in the law that is good in an aspirational sense. So one of the things you'll frequently see cited if you read legal opinions or court orders is best interest of the child, the best interest of the child, or the polar star. You'll see things like that. Frankly, I don't believe that to be the case in reality more often than not. And that's not to say that these individuals don't care about children. I certainly think they do. I just think the system itself is designed in such a way that it benefits respondents, and it does not benefit, or at least it certainly does not prioritize the rights of children as much as, say, it prioritizes the rights of reunification, quite frankly, which is important. We know that ideally, children do best when reunified with their caregivers, unquestionably. But when you have a case where children are removed again and again and again and again and again, and you're putting them back into these situations and you're never really addressing it, and you're just hoping for different results, you have years go by. And I think that's something important for those who are involved in the system to reckon with. It might be a couple months isn't that long for you in your docket. It's a heck of a long time for a kid. And for example, the son that we adopted, that case drug on for 3 years, and that was a case with positive outcome, with very dedicated judicial personnel and court personnel. That's not always the case in terms of the negative outcomes that we often see. So it's ultimately designed to protect the rights of adults, and it disproportionately prioritizes those rights, in my opinion. I mean, there's plenty of examples we could use. I think it would be hard for you to find a foster care parent who would have an overall positive assessment of the system, quite frankly. And that's not to negate the importance of foster care parents. I hope one of the takeaways isn't this negative, like discouraging in that, because we need it. I mean, the system, these kids need foster parents desperately, but certainly want to be clear-eyed about what the reality of the system is. For example, like a toddler being shipped across the state every week for visitation out of convenience to caregivers, for example. An entire day. 8-hour trip visit in the middle, 8-hour round trip visit in the middle. It happens. It shouldn't, but it happens. Improvement periods frequently given to those who've been repeatedly convicted, felony convictions of child abuse, not neglect, abuse, repeated domestic battery convictions. This happens quite a bit. And you have these kids who are pulled in and out of the home. This isn't, they're just removed and that's that. And foster care, that's not what it looks like. At least that's not typically what it looks like anecdotally. It's about kids being pulled out of the homes, oftentimes put into residential care facilities, bouncing around the system a little bit, maybe coming into contact with the criminal justice system through a juvenile case, oftentimes from behaviors that happen in these residential settings or in foster care settings, and then coming back out, being put back in the home, but the underlying issues within the home haven't truly been addressed because there have been inadequate communal supports, inadequate community resources, or they're just certain issues, sexual abuse, for example, just aren't going to be resolved in a way that we can adequately feel good about the safety of a child in that home. And they just go in and out, and it drags on. I was trying to explain all this to an 8-year-old, victim on my docket. So I'm trying to explain all this. I didn't go into detail, but at one point, I'm explaining, and the defendant has these rights. He has the right to this and this and this and this and this. And at one point, the 8-year-old interrupts me and says, "Well, what about my rights?" I'm like, that's a pretty good point. That's a fair point. That's a fair point. And I do see, I think from a public standpoint, we're missing the target on this one, because often what we do is blame an agency, quite frankly, or we'll blame a worker, or we'll blame a judge or an investigator, whatever the case may be. That misses the point. It's the entire system. It's the entire system. And so we have to think at a very broad level, what does a system that better prioritizes children looks like? And if I'm being honest, and it won't make me any friends, but it's not the system we have now.
And I totally agree with you, Robert. And the other thing I will say, or just add to that, is in my experience, the more I learn, the less I know. I have yet to have two identical situations. And so I think that's the other challenge, is we're looking for kind of a cookie cutter approach.
Yep.
And it's like every situation is unique, every child is unique, every family is unique. So while we can apply standards, we can't necessarily say, oh, this is going to work for everybody. And again, if we're looking at active substance use disorder, these people are on their pathway of handling their own disease. And so just the level of it, and it almost becomes overwhelming. But at the end of the day, I'm like, if we just love our children and we love all of the children in our community, not just the ones that live in our home, then I think our communities can come together and we can do this.
Yeah. And if one more post note on that, I think I'd connect what you're saying, Cindy, to what Kelly said earlier about listening. I think that's sort of a fundamental problem on the systemic side. Foster care parents are members of the MDT. They're members of the multidisciplinary team. And very often they're not there. And these are the people who have, and oftentimes you have critical parties that are omitted just from a planning standpoint. And these types of decisions are made often amongst attorneys 5 minutes before a hearing. And maybe they've had, and again, I know there are many jurisdictions and individuals that are working extremely hard, extremely long hours, so I don't want to denigrate any of that. But in many jurisdictions, we know this to be the case. Foster care parents aren't even at the table on the MDT. So this goes back, I think, to what Kelly was saying about listening and listening to the needs of all involved, and we're going to be able to craft better solutions.
Yeah. And to build off of what you said earlier about the eight hours round trip, I mean, so if I have babies, I have toddlers who experience that. So there's one day, sometimes 2 days a week, that we can't provide birth to 3 services or in-home services because the child might be traveling. So they're in that semi-neglected position or semi-reclined position of being in a car seat for 8 hours, or for 4 hours and then held maybe, and then 4 more hours home. So we're missing that critical part of early development as well for those kids that should be receiving birth to 3 services. So we're focusing on making them just as absolutely amazing and giving them the things they need to succeed. And we're, again, as you said, looking at reunification is the goal, is not necessarily the safety and security of what that child needs to succeed. And so I think we lose some of that because our system is broken and there isn't one easy answer to all of this.
I'll say this and then ask the next question. So we know that a number of our legislators and policymakers have been talking about this issue, but it's been very compartmentalized. So healthcare talks about it in terms of healthcare, public ed talks about it in terms of public ed, community resources talk about it in a different way than the court system does. And then when we try and talk about it collectively, we don't. And we act as if it's too hard. And yet, these kids are navigating in and out in these families of all of these systems all the time. And so you may have a community resource or program, and you say, well, here's when it's provided, but that child can't get to it because that child's traveling 8 hours due to something going on with the court system. And you never have these people in the same room discussing the challenges that a decision this system makes on this system that's supposed to be helping the child as well. So if we had some kind of kid-centric collaborative that looks at all of these different systems and how it affects specifically the child and not, like you said, the adult, perhaps we would get a little better at addressing these challenges.
Yeah, that's that's a perfect example of it. The whole paradigm for solutions is adult centric, right? As you just stated, it's about what is convenient for the adults in those specific fields. What are the specific issues that they need to grapple with, and not so much what that child centric perspective of I've got to navigate it all. So again, that was well put.
Yeah. And just again, think about that child. Like, they don't have emotional regulation, emotional energy, or endurance, and they're the ones that we are asking to be flexible, and kind of take all those bumps instead of the adults. And we're the ones that are supposed to be the protectors and should be making those compromises.
Yep.
And our kids are facing that.
Great. Yes, that's a great point, and it leads well into the next question. Kids aren't kids forever. If there are first steps we can take to helping affected children, making their lives more normal or getting them on paths to brighter futures, what can we do to help?
Well, I think we've all talked about the aspect of community, and the aspect of communication. I know that when I was in Washington, D.C. last year, you know, the White House came out with a whole rural health drug policy recommendation. And really what it says is it has to start on the community level, which is absolutely the case. We know our communities best. I know Fayette County because I live here in Fayette County. I don't necessarily know Kanawha County. And so really coming together, and pulling those resources. I know many counties have started with like putting a toolkit together through the Osteopathic School of Medicine in Lewisburg. And it's like we just put all of the resources in a particular county together in one booklet. So healthcare providers, you know, everybody has access to that information. And it was very eye-opening about, oh my gosh, these things are available. But then here in Fayette County, at least, the Iceland Collaborative, and just after school programming and having green spaces, outdoor spaces, and places for kids to play and kids to be kids and not be bullied or not have to worry about what's on the internet. You know what I mean? Those are the kind of things that I think that when a community comes together, we all rise up. And so to me, so much of it happens on the community level, and we really just need, I think, to be figuring out how to engage our communities, to just be a little bit more than what we are right now.
Yeah. I echo that. On the individual side, certainly would direct individuals to those toolkits that we mentioned. On the community, ultimately, individuals don't end abuse, communities end abuse, as Cindy's saying. So I think I love that approach of assessing, okay, what are the resources in a given community? And it is eye-opening when you realize what you do have available. And I think that that's the missing piece at the state level. I think there's a couple pockets in different counties that seem to be doing pretty well at that. That's what we need to have it from more of a state framework. Another thing I would throw out there in terms of potential impact community relationships would be faith communities. I think that is those entities, if they're whatever, regardless of your religious beliefs or lack thereof, those are entities that, if fully engaged, for one thing, could overnight end the foster care placement crisis just from sheer numbers. Now, that doesn't deal with some of the deeper issues that we need to grapple with, certainly. But I mean, just imagine if every faith community were proactive on this. What you mentioned, Kelly, 7,000 kids in foster care. If every church took a family and put it and had a foster care family to step up, you'd immediately end that placement crisis immediately. And the beauty of that too is, as Cindy said, if you go at this individually as a foster care parent, as I have, you're unlikely to be successful. You're unlikely to be successful. At a very least, you're going to come out pretty beat up because you really can't go at it alone. You have to have these supportive pieces around you. And so that's what I sort of love about, faith community engagement on this specifically. You could have another individual that goes through the training for respite care. You could have another family stepping in for providing meals and things like that, or sitting or errand running and things like that. It is really difficult to be a foster care parent. I think we should be honest about that. But if we approach it from a communal perspective, I know it's going to improve foster care parent resilience. And ultimately, I think that community involvement is what ends abuse in terms of developing child protection policies. And that's a whole nother story.
I completely agree with you. It's always amazing to me when we have meetings like on a state level and we talk about some of these issues. And we know on the community level that the faith-based organizations are doing a lot of work. But then when it comes to kind of the government bureaucratic state level, what are the answers? They're not at the table. And it's the people who are really kind of doing that work on the community level who aren't there to inform, how the community is responding to ensure that things are connecting on the state level and community level. So
Right.
I think you're absolutely right about that.
Yeah.
We have one last question, then we're going to turn to Maddie. If there's one thing you think folks who do not work with these kids don't get, like what don't they see and understand? What is it? What would you like for them to know? And we'll start with Cindy.
At the end of the day, they're children. They want what we all want, love and acceptance. And so while those behaviors, and we talked about this a little bit earlier and Robert said it, there are no bad children, there's just bad circumstances. And so often I think we get caught up on the behavior, that we forget that there's a reason that they're behaving that way, and we need to help them figure out why, to teach them appropriate coping strategies. So that's probably my big takeaway. And again, giving a child a hug when it's not COVID, giving them a smile, making eye contact with them in the grocery store, adopting a family, taking somebody a meal. I mean, just doing what West Virginians do so beautifully every day would make such an amazing difference.
Thanks for that. Robert?
Yeah, I'll cheat and say two things. I think so. There are a couple of things that really stuck with me just from prosecution. One of them was a letter received from a child victim in a case where we were successful in obtaining a conviction in a sexual assault case, and the young child said, "Thank you for winning." But it wouldn't have mattered even if you didn't win. A lot of times what children are looking for is someone to just be in their corner fighting for them. And so looking for a champion who's going to stand up and deal with what needs dealt with on their behalf. The part two of that is a great quote again from Handle with Care's excellent social media feed from Dr. Bruce Perry. If you don't use the right lens, you're going to end up seeing the wrong thing. We know that children are certainly capable of resilience. They simply need an adult to listen, to be in their corner, and to use that right lens to see past the behavior and fight for them.
Wow, that was excellent. Awesome. Thank you both for those answers. Maddie, we're turning to you. Are there any questions or comments?
No questions, but there's a comment from Chamberlain. She said, please feel free to email her information about where she can start to help out, but no questions.
Okay. That's exciting. That's the kind of response we love to see. So I will.
Yeah, that's awesome.
Yeah, we'll message you and see if we can get you connected, because like I said, we've got some wonderful groups that are working on some of these issues around the state, and we'll see if we can plug you in. So with that, we'll wrap up the conversation. I'd like to thank Cindy and Robert for their time and expertise today, as well as those of you who joined us on Facebook. If you missed some of the discussion or know someone who may be interested in this conversation, we'll have the video posted with the links that we discussed on our YouTube channel tomorrow. And of course, we'll have links to all of that on our Facebook and other social media sites. Please stay connected with us. We have a Facebook group dedicated solely to these challenges and potential solutions to helping kids affected by the drug crisis. And we hope you'll join us there. So thanks again for joining us. And we hope you have a very happy and safe Thanksgiving. Bye, everyone.
Bye-bye.